Hello everyone, warm greetings. I'm Meera Selvan, a final year MSc Psychology student from Christu Jayanti College, Bangalore, is going to be speaking about a disorder called agoraphobia. The major motive for creating this video is to spread awareness regarding this disorder. So I'm going to be giving a brief introduction about what is agoraphobia, and then I'll be covering certain topics such as the signs and symptoms, the causes, the risk factors, the prevention of agoraphobia, and the treatment, and when are you supposed to see a doctor. So let's begin. So, what is agoraphobia? It is basically an anxiety disorder in which the individuals fear and avoid places or situations which might make them panic or which might make them feel trapped, embarrassed, or helpless in such situations. The individuals basically avoid situations such as using a public transport or being in a crowd or standing in a line. Also, they avoid situations such as being in open places or being in enclosed spaces. And they always look for a companion if they have to face situations of this sort. Over here, the anxiety in the individual is caused by the fear that there will be no easy way to escape or get help if the anxiety intensifies. Individuals that have agoraphobia generally develop it after having a panic attack in certain situations or places. For example, some people might get anxious or fear about going to some open places, or some people might fear using public transport. So when they have a panic attack at that situation, then they always try to avoid another panic attack in certain situations or places. So they might as well stop using public transport. And the people that have agoraphobia often have a hard time feeling safe in public places or the places where crowd gather. So that's when they think that they need a companion to go out. So let's now know about the signs and symptoms associated with this disorder. First of all, the individuals that have agoraphobia find it really difficult to leave their home alone, and they have a hard time in being in enclosed spaces such as movie theaters, elevators, or any small stores. And they also find it very difficult to wait in a line or be in a crowd. People with agoraphobia also find it very difficult to be in open spaces such as a bridge, parking lots, etc. And they also find it difficult to use public transportation such as a plane, train, or bus. The above mentioned situations causes anxiety in the individuals because they feel that there won't be any easy escape, or they won't be getting any help if they start to panic, or if they have any other embarrassing actions from their part. So that is when they get very anxious, and they try to avoid these situations. And the fear or the anxiety results almost always because of the exposure to the situation. And anxiety or the fear is out of proportion to the actual danger of the situation, which means that there might not be really any complication with respect to using a public transport or being in enclosed spaces such as an elevator, but they might think that something worse might happen. So that is when they try to avoid using an elevator or going via public transport. Other signs are that the individuals might completely avoid the events where they actually need a companion to go out with, or they might actually face the events but they will be completely distressed. Due to this anxiety and fear with respect to certain particular situations, the individual finds it difficult or has problem in other areas of life such as their personal life, their work life, and their social life. It gets really hard for the individual to even go out of the house at certain point of time, and the individuals actually depend completely upon a companion. And usually the phobia or the fear lasts for about 6 months or longer. And the individual, suppose, has any other medical conditions already, for example, Parkinson's disease, then there is a high chance that the fear and the avoidance is more in them. That is, them reacting to a fearful situation. Uh, the emotion which they show is much more intense. Now, coming to the causes, the reason that an individual might develop agoraphobia could be genetics as well. If the person's relative or anyone in the family has, then they might have the chances of developing a disorder. And the other causal factors could be a person's general medical health conditions, and their temperament, how they handle certain situations. In general, if they have fear towards any event, it could be any situations, etc. And their learning experience also play a major role in developing this disorder. And there are certain environmental stress factors also which are associated in the development of agoraphobia. Now, coming to the risk factors, agoraphobia can start in the childhood, but usually it develops in the late teen or early adulthood. And approximately 1.7% of adolescents and adults have a diagnosis of agoraphobia. Usually, this disorder develops before the age of 35 years, but that does not mean that older adults cannot develop it. There are high chances that even they can develop it. And women are diagnosed with agoraphobia more often than men. The other risk factors are having panic attacks or any other type of phobias, or responding to the panic attacks with excessive amount of fear and avoidance, experiencing stressful life events such as abuse or loss of a loved one, or being attacked by someone, or having a blood relative with agoraphobia, or having a very anxious or nervous temperament. Even these could be high risk factors which can lead to agoraphobia. So there are several complications due to this disorder. The individuals that have agoraphobia greatly limit their life situations. For instance, in severe cases, the individuals even do not get out of their home, and if treatment is not given on time, people might even become homebound for several years. In some cases, the individuals even stop meeting their family and friends, they stop visiting their relatives' places, and they completely depend on another people for day to day activities also. Some people even stop doing day to day activities such as going out for a walk, and they even stop going for work also. And having this disorder is not very easy. Life becomes very tough for them, and it's very important to consult a therapist or a psychiatrist at the right time. And the major question is when to see a psychiatrist or a psychologist. So the right time is when the individual is having all the above mentioned the symptoms and signs which I had mentioned previously, such as not being able to leave their home, or be in enclosed spaces, or be in some crowds. And when they have lot of anxiety and panic attacks, when they are put to be in such situations, and this entire thing is happening for a prolonged period of time, then that is when they have to be taken to a therapist or a psychiatrist. And what happens is that individuals that are facing this might not agree to go to a therapist, and the best thing could be their companions, their partners, or their friends or family can decide if this is hindering their day-to-day life activities. Then that's when they should take them to a psychiatrist or a therapist. And now I want to also talk about the prevention and the treatment. It's not completely possible to prevent agoraphobia, because there is so much of anxiety associated with it, and so much of other factors also play a role. And the best things that could be done is to not avoid an event completely. That is, if a person feels suffocated in an elevator or in a small store, that does not mean that they should completely avoid it. The best thing could be that they can take their uh, friends or family along with them and visit such places, uh, like sometime, at least sometime in a week or something like that. And they should not avoid the anxiety provoking events completely. So, coming to the treatment, some of the techniques that can be used for agoraphobia are cognitive behavior therapy, exposure and response prevention, systematic desensitization, and psychotherapy. You can even consult a psychiatrist for certain medications. Thank you so much for watching the video. I hope it gives you some insights into what agoraphobia is. Thank you.